I don't know if it's creative, but it's interesting, at least to me, and I'll tell you, it certainly was this morning with my household, my 4 kids, that, and excuse them and forgive me, seemed more intrigued by this slide that we were working on than anything else related to this pandemic, because of their love for animals. We have 2 gorillas at the San Diego Zoo that now have tested positive for COVID-19. 2 that have been tested positive. We have another that's symptomatic. We're currently confirming the source of the infection and the strain. There is some question, did it come human to animal? That's being determined, and one has to respect that process and the adjudication of the facts. But nonetheless, it's just an area that's long been of concern, human to animal transmission, but our beloved gorillas, obviously, we are concerned about, and San Diego Zoo, best of the best. They've tested now formally 2 positive, but 3 are symptomatic, and we are likely to see more information about this in real time in the next hours, not just days. But I thought I'd just bring it up because, as I say often to all of you, what tends to resonate in my house, I want to make public to you in real time, and that's the update in terms of the status of these gorillas in the San Diego Zoo. So
from the basement.
CNN anchor Chris Cuomo is out of quarantine, recovered from COVID-19, and reunited with his family.
This is the dream, just to be back up here doing normal things.
Cuomo's 17-year-old daughter Bella has been taking care of the family.
My dad has corona, but he's going to be okay. He's actually doing really well right now.
And showed off the hazmat suit she used when checking on her dad.
Million cases of COVID-19. CDC's most recent data show that the 7-day average of new cases is slightly less than 60,000 cases per day. This is a 10% increase compared to the prior 7-day period. Hospitalizations have also increased. The most recent 7-day average, about 4,800 admissions per day, is up from 4,600 admissions per day in the prior 7-day period. And deaths, which typically lag behind cases and hospitalizations, have now started to rise, increasing nearly 3% to a 7-day average of approximately 1,000 deaths per day. When I first started at CDC about 2 months ago, I made a promise to you. I would tell you the truth, even if it was not the news we wanted to hear. Now is one of those times when I have to share the truth, and I have to hope and trust you will listen. I'm going to pause here. I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now I'm scared. I know what it's like as a physician to stand in that patient room, gowned, gloved, masked, shielded, and to be the last person to touch someone else's loved one because their loved one couldn't be there. I know what it's like when you're the physician, when you're the healthcare provider, and you're worried that you don't have the resources to take care of the patients in front of you. I know that feeling of nausea when you read the crisis standards of care and you wonder whether there are going to be enough ventilators to go around and who's going to make that choice. And I know what it's like to pull up to your hospital every day and see the extra morgue sitting outside. I didn't know at the time when it would stop. We didn't have the science to tell us. We were just scared. We have come such a long way. 3 historic scientific breakthrough vaccines, and we are rolling them out so very fast. So I'm speaking today not necessarily as your CDC director, or not only as your CDC director, but as a wife, as a mother, as a daughter, to ask you to just please hold on a little while longer. I so badly want to be done. I know you all so badly want to be done. We are just almost there, but not quite yet. And so I'm asking you to just hold on a little longer, to get vaccinated when you can, so that all of those people that we all love will still be here when this pandemic ends.
Is that okay so far? My name is Rochelle Walensky, and I am the director of the Centers for Disease Control and Prevention.
How do we get this pandemic under control?
We have to mask, we have to socially distance, we have to wash our hands, we have to avoid crowds, avoid travel, and then we have to get vaccinated when we can.
Explain the COVID mutations and how we stop them.
So when viruses mutate, they can make mistakes when they replicate, and when they replicate and make mistakes, sometimes they have some advantage to the virus. So the new variants are just like the old variants in terms of the disease. However, they may be less forgiving. So if there was a mask breach before, that might not have caused disease, it might this time. So we just have to do the exact same things.
If someone has had COVID-19, should they still get the vaccination?
It's likely if you've had COVID-19 before, you still have some immune protection up to at least about 90 days. So yes, you're eligible for vaccination, but we might ask that you consider waiting so that others who don't have any immunity could get vaccinated before you.
Will we need to retake the vaccine every so often?
We don't have data on that yet. The vaccine trials are looking out to 2 years, and so those data will be forthcoming, and as soon as we have them, we'll let the public know.
Are we on track to administer 100 million shots in the first 100 days?
We are absolutely on track. We have been working really hard. At day 100, we're not done. We still have 200 million more Americans that we need to get vaccinated, and that track record will continue.
What's the biggest COVID-19 myth that you would like to get rid of right now?
That masking doesn't work. Okay, awesome. That was fun. Okay.
I would definitely take the Johnson & Johnson vaccine. My name is Dr. Anthony Fauci, and I'm the director of the National Institute of Allergy and Infectious Diseases and the chief medical advisor to President Biden, and I'm going to answer questions about the Johnson & Johnson vaccine. This is a vaccine that works, and it only requires one dose. The Johnson & Johnson vaccine uses a particular, what we call, vaccine platform, and you inject it into the body sees that protein, makes a good immune response against the entire virus. The COVID vaccine doesn't give you COVID because it's not the virus. It's just one protein from the virus that induces your body to make a good response against the whole virus. Well, it's not. Tested in the United States, it's 72% effective in preventing you from getting moderate to severe disease, but virtually 100% protective against hospitalizations and death, as proven by this trial that was done. For the record, that masks are not theater, masks are protective, and we have immunity there. First of all, when you have a variant, you have an immunity that you get what's convalescent sera, and the same sort of thing. If I vaccinate you or me against the wild type, you get a certain level of antibody that's specific for a particular viral strain. If there's a circulating variant, you don't necessarily have it. You have some spillover immunity to be sure, but you diminish by anywhere from 2 to 8-fold the protection. So the point I'm saying is that there are variants in now circulating. The point that Senator Paul was making was that if you look at wild type only, there is some clear-cut credence to what he's saying. But we are living right now in a situation where we're having a dominance of 117, which was the original UK. We have a very troublesome variant in New York City, a 526. We've got 2 variants in California, a 427, 429, and we have a number of others. So we're not dealing with a static situation of the same virus.
This is a woman who ran the second largest Attorney General's office in America after the United States Attorney General in the state of California, and has done a great deal upholding human rights, but also fighting organized crime in the process. So it's not her full responsibility and job, but she's leading the effort, because I think the best thing to do is to put someone who, when he or she speaks, they don't have to wonder about, is that where the president is? When she speaks for me, doesn't have to check with me, she knows what she's doing, and I hope we can move this along. So, Madam Vice President, thank you. I gave you a tough job, and you're smiling, but there's no one better capable of trying to organize this.
Well, thank you, Mr. President, and for having the confidence in me. And there's no question that this is a challenging situation. As the President has said, there are many factors that lead President to leave these countries. And while we are clear that people should not come to the border now, we also understand that we will enforce the law, and that we also, because we can chew gum and walk at the same time, must address the root causes that cause people to make the trek, as the president has described, to come here.
To the border.
At some point I will, yes.
Do you want to see firsthand what's going on in those facilities?
I know what's going on in those facilities.
Do you have plans to visit the border?
Not today, but I have before, and I'm sure I will again.